Hi, my name is Colleen Stone. I'm a program specialist and I oversee the TSA Cares and PSS programs at the LAX Hub and Spoke airports. Today we had an opportunity to have a special guest speaker to tell us all about hidden disabilities in general and hemophilia in particular. It's really important that the screening workforce is aware of this condition and how many of our passengers suffer from a bleeding disorder, and to have your understanding and your guidance. This is a training tool for our screening workforce in helping them to better understand and be able to screen our passengers with hidden disabilities.
I'd always known that I would never play football or ride a motorcycle or join the military. At age 2, the doctor told my mom we don't really want him to jump. So at all the birthday parties, I was never allowed to go on the trampolines or the bouncy houses. At age 7, I woke up in the middle of the night with a kidney bleed. And by age 9, I ended up needing a wheelchair from time to time. So you can imagine, I never expected to travel much. My name is Nathan Mermilliod, and I've lived with hemophilia my whole life. Today, I'm going to explain what hemophilia is, what it's like to live with it, and how you can help the bleeding disorders community have a safe travel experience. Hidden disabilities can be any condition that is not immediately apparent, and they can range from rare to common. And while the focus of this presentation is hemophilia, there are many people with other hidden disabilities who may have similar needs when traveling. I'm sure you've encountered many, like ADHD, fibromyalgia, PTSD, diabetes, and more. But what is hemophilia? Hemophilia is a type of bleeding disorder. The blood contains many parts, including red and white blood cells, platelets, fibrin, and 13 factors, which are proteins. Having hemophilia means my blood doesn't clot properly because I'm missing one of the factors in my blood. I'm missing factor 9, which means I have hemophilia B. Clotting is a complicated process. You can think of the process like a series of dominoes. When you have all the factors, the process works well and all the dominoes fall. But if you're missing just one domino, like I'm missing factor 9, the process stops, which means I don't usually stop bleeding quickly or easily. The level of deficiency also affects the severity of the disorder. For you, the normal level of any one factor is 90% or above. I have less than 1% of factor 9 in my blood, which means I have severe hemophilia B. I have a very different life than someone with, say, mild hemophilia. I have to take medication regularly to prevent bleeds, while someone with mild hemophilia may only have to treat for surgery, or in the event of a car accident, or when traveling. Because I have hemophilia, I bleed internally. Bleeds can be spontaneous, meaning they can happen without any known cause, or they can occur with trauma or injury. Bleeds occur in my soft tissues, joints, muscles, and organs. The soft tissue ones are just bruises, like you get, but often more severe. It's the joint, muscle, and organ bleeds that can be limb or life-threatening. With joint bleeds, blood fills the space in the joint and causes a lot of pain and pressure, and I can't bend the joint normally. The blood sitting inside the joint can deteriorate or break down the joint over time. These need to be treated right away to keep my joints healthy for my whole life. I've had a few muscle and organ bleeds, and while they're less common, they're more serious. The worst places to be injured are in the head, neck, chest, stomach, spine, and groin. Major injuries to these places are emergencies and require a call to 911. I take a medicine called Factor when I have a serious bleed or a major injury. Factor is actually the factor 9 that I'm missing, and it goes into my vein through a needle. I also have to take Factor prophylactically or preventatively. I mix and administer it every Monday. In the past, I've had a lot of joint bleeds, mostly in my knees and ankles. And for a while, I had to use a wheelchair, wear crutches, and take Factor every other day for 2 years. I kind of brought that on myself. Basically, I've always wanted to be very active, which was sometimes a bit of a challenge for my parents. I was 7 years old in the photo on the left of me on the jungle gym, and right after my mom took the picture, I fell, and I woke up later in the middle of the night with a kidney bleed. Baseball was a big part of my life for many years. That was only possible with a lot of risk management, like prophylactic factor treatment and protective gear. Safe exercise, like golf, has always been important for me so that I can maintain strong joints and muscles. I've also been on the stage my whole life. I got to play the role of Peter Pan when I was 10 years old. But during rehearsal, the tech crew accidentally flew me into the back of the window set instead of through it, and I was still managing a knee bleed on crutches backstage on opening night. It's tricky because in these pictures, I look like a normal kid, but I was constantly dealing with bleeds, injuries, and hospital visits. This can be a lot to handle. I have close relationships with my doctors. We talk about how to minimize risks and maximize benefits before deciding if an activity is safe for me. The risks are all about physical injury, but the benefits are about much more than physical health. I see feeling normal and fitting in as a big benefit. Like travel. Even though there are risks with flying and being far away from home, the benefits of travel make it all worth it. Hemophiliacs have a lot to think about normally, and even more so when it comes to traveling. So they can be under a lot of stress even before you see them at the security checkpoint. Trust me, I'm thinking about you way before you're thinking about me. Just preparing for my trip to New York was very challenging. I had to visit my doctor, and I had to update my travel letter, explaining my disability, medical needs, and treatment. I located a hemophilia treatment center near my destination, and I called ahead to make sure they knew I would be in the area in case I needed emergency treatment. Factor is expensive, and it's not readily available at all hospitals. So I had to consider how much factor medication I needed to bring with me to cover prophylactic treatment, emergency doses, plus supplies. And authorizations from my specialty pharmacy and health insurance had to be put in place. All this means that I show up to security checkpoint with a little anxiety and a lot of bags. These are the medically necessary items that I must take with me on board the airplane. Factor, of course, Amicar, and oral medication for mouth bleeds, syringes and needles, a travel sharps container, freezer gel packs and instant ice packs, compression bandages, and much more. People with ports also need to pack disinfectants and sterile saline or heparin. Parents may be carrying Emla cream, a numbing product used when infusing children. And hemophiliacs who also have inhibitors, hepatitis C, or HIV will need to pack additional supplies. My factor, which is kept separated as a vial of powder and a syringe of diluent, must be kept within a specific temperature range, making freezer packs medically necessary to keep it cool when traveling. Depending on which airport I depart, it can be 2 hours or more from leaving my house to arriving at the checkpoint, which means my frozen solid gel pack might be on the slushy side by the time you inspect it, but it's still able to keep my factor safe. While I'm grateful that airport vendors can provide fresh ice, it's an unreliable option when my life-saving medication may depend on it. Taking these supplies through security checkpoint makes me nervous. I worry that my sterile items might become compromised by the screening process. Maybe they don't meet the requirements and I won't be able to take them on the airplane. The line is long and I miss my flight. Maybe you feel as rushed as I do and won't really listen to me. Or I'll be seen as a difficult passenger you'd rather not deal with. I realize that my concerns aren't always justified because TSA has measures to allow disabled persons to board with their medication. But people with hemophilia like me still deal with the stress. A few simple gestures would help reduce our anxiety. A smile, kindness in your voice, and a simple but affirmative, "No problem." Since you can't always see hemophilia, one of the most important things you can do is trust a passenger when they tell you that they have a bleed or injury, and allow them alternate safe screening options. But I admit, we might not always tell you. Many hemophiliacs prefer to not draw attention to themselves or talk much about their disability, but could still be experiencing anxiety, have a bleed or injury, be carrying factor on board, or need a wheelchair or crutches. For that reason, just being mindful that these types of hidden disabilities exist goes a long way to easing the minds of all passengers, because you'll be ready to be empathetic when a problem does come up. On another trip to New York City, I walked around with my family a lot, and I developed an ankle bleed while I was there. Flying home through the checkpoint with an active bleed raised a lot of concerns I hadn't counted on at the security checkpoint. It hurt to walk and stand in the long checkpoint line. It was difficult and a little painful to take off my shoes, especially quickly. I really needed a pair of crutches or a cane, but of course this bleed was unexpected, so I hadn't traveled with these items. Other bleeds can pose different problems. A shoulder or elbow bleed might prevent me from lifting my arm fully during a pat-down. Muscle bleeds are especially painful to the touch and may worsen with contact. So if you're told or you recognize someone experiencing a bleed or injury, it's safe to assume that there's likely more going on there than what you can see. That's just the nature of hidden disabilities. Although it's rare, hemophilia has its own awareness month. It's March. In 2016, the National Hemophilia Foundation and the U.S. Department of Health and Human Services worked together to designate March as Bleeding Disorders Awareness Month, an official U.S. health observance month, further broadening our community of inclusion and support. Is there a cure for hemophilia? Not yet. A cure may or may not come in my lifetime, but a lot of advancements in science have been made, such as in safer treatments, longer-lasting products, and more effective bleed management. In the 1950s, only 60% of severe hemophilia patients lived to adulthood. But today, people with hemophilia can live a long and healthy life. And with your help, that life can include travel. People with bleeding disorders choose to travel for many reasons beyond personal interest. Education and fellowship are a big part of our small but active community. Thousands travel annually to the National Hemophilia Foundation Conference, and other local and national and international organizations have annual conferences as well. Additionally, advocacy is an important focus in the bleeding disorders community, with regular travel to lobby state and national leaders, with events like Washington Days and Ledge Day. It's been my mission to spread awareness about hemophilia. And it might surprise you that TSA already has a little history with the hemophilia community. In March 2009, TSA representatives attended our Hemophilia Foundation of Southern California's annual Family Information Day to present Factor in Flight, How to Travel with Confidence, and supplies. And was held on the Queen Mary that year. My grandmother, a uniformed officer at the time, acknowledged hidden disabilities, described the screening process and allowances for medication, and demonstrated a pat-down with me as her small model before hundreds of members of the bleeding disorders community. The TSA Cares program was created well after that event in 2012. And when traveling for Hemophilia the Musical, TSA Cares officer at the Ontario airport met me at the entrance to the security checkpoint, stayed with me through the whole process, explaining what came next and addressing my concerns. Having a representative through TSA Cares program greatly reduced my stress and provided me and my travel needs a sense of legitimacy. My overall experience traveling with hemophilia has been positive. Thank you for doing all that you are to consider the needs of passengers with disabilities, hidden or otherwise, and treat us with dignity and respect. When you help us travel, you're contributing to a normal life experience. Thank you for giving me the opportunity to speak to you today about hemophilia, for supporting people with bleeding disorders, and for helping all people with hidden disabilities travel safely.